Hi and welcome to Shape Your Life. I'm your host, Ronald Avergy, and this week we take a closer look at TB. TB continues to be a leading cause of death in South Africa. Our country ranks third in the world with prevalence of this disease, which has seen an increase by 400% over the past 15 years. Stay tuned to find out how tuberculosis spreads and a healthy, delicious recipe coming your way.
This week on Shape Your Life, we take a closer look at TB.
Every year, 9 million people get sick with TB, and 3 million don't get the care they need. Our medical professional tells us what signs and symptoms you need to look out for. I'm with Dr. Mariska Botha to find out more about TB. Dr. Botha, what is TB?
Well, Ronald, basically TB is caused by a bacteria called Mycobacterium tuberculosis. The majority of the population, about a third, is already infected with TB, but you won't have active disease unless you're immunocompromised. So TB typically affects people who have HIV, diabetic patients, cancer patients, or even smokers.
How do we contract TB?
TB is spread by droplet spread, so if someone is actively infected, not on treatment or in the first phase of treatment, if they cough or sneeze around you, you can actually contract it from them.
And what are the signs and symptoms that you could have TB?
Usually you would have a productive cough or coughing of blood for more than 2 weeks. You could have fever, night sweats, or unexplained weight loss.
But wouldn't that just be signs and symptoms of a cold?
That is the problem. But usually what happens is they go to local clinics and first they treat it with broad spectrum antibiotics, but then it persists. So if any symptom persists, you should always go back and get tested.
And what is the treatment protocol for someone with TB?
Okay, the treatment, first of all, they need to do drug susceptibility testing on a confirmed TB case. You need to make sure the patient does not have MDR or XDR TB. But if it's just plain TB, the treatment is for 6 months. First 2 months, it's a 4-drug protocol, and thereafter, for the remaining 4 months, it's just 2 drugs. MDR and XDR TB, obviously, it's targeted to what they're susceptible to, and it could be prolonged to more than 2 years.
What is MDR and XDR TB?
MDR TB, by definition, means that the patient's tuberculosis is resistant to the 2 commonest drugs that we use, being rifampicin and isoniazid. XDR means that they're resistant to 4 or more of these drugs.
Now, when it comes to the treatment of TB, how important is adherence to the medical routine?
That is the most important factor, and it's very difficult. You can imagine having to take something for 6 months rigorously, and especially if it causes unwanted side effects. That's why they have a protocol called DOTS that they implement at the local clinics. It's called Direct Observed Treatment Strategy. So they actually need to go in to the nurses and be directly observed that they do drink the medicine, or nurses can go to their homes. But the family also plays an important role in supporting them.
Do lifestyle factors assist in the treatment of TB, or do they actually increase your risk of contracting TB?
Yes, definitely. Like I've mentioned, a risk factor for contracting TB is being immunosuppressed. So things like smoking or excessive alcohol use can increase your risk. General health obviously accelerates healing and general well-being. So healthy, balanced diet, exercise, and avoiding smoking and these factors.
What is your final pearl of wisdom to the viewers out there who suffer from TB or know someone that does?
Okay, well, first of all, I don't think that people should be shy about it, and they should, if they have any persistent symptoms, like I've mentioned, rather go for screening, go for early testing and early treatment, because it is a preventable and treatable disease.
Don't ignore TB symptoms. If you have a cough that won't go away or other TB symptoms, go and see a doctor and ask to be tested for TB. Early diagnosis means there is less chance of long-term damage to your body, makes it easier to treat, and reduces the risk of other people catching TB from you.